medicinal plants in medical science. When we talk about medicinal plants and their place in medical science, the first question that comes to mind is whether medicinal plants play a role in the prevention and treatment of diseases. Studies conducted on medicinal plants have shown that they play an important role in both prevention and treatment of diseases. And they also play a role in the treatment of diseases. Medicinal plants help prevent diseases by boosting the immune system. They combat pathogens, aiding in disease prevention. Echinacea and black cohosh are examples used to boost the immune system. Medicinal plants can help prevent infectious diseases by strengthening the immune system and combating pathogens like viruses, fungi, bacteria, and parasites. Echinacea and black cohosh are commonly used in supplements in Europe and America to boost the immune system, helping prevent illnesses like the common cold and influenza. Cranberry plays a role in preventing urinary tract infections. Regarding non-communicable diseases, garlic has been shown to reduce the risk of digestive system cancers, including colorectal and stomach cancer, with pronounced effects in the Asian population. And by strengthening the immune system and combating pathogens, they can play a role in preventing diseases like the common cold and influenza. Another plant we can mention in the context of preventing infectious diseases is the cranberry, which helps prevent urinary tract infections. Also, ginkgo is shown to prevent atherosclerosis and vascular blockage. Miswak reduces plaque, gum inflammation, and oral diseases. Another plant that we can consider in the prevention of non-communicable diseases is the ginkgo plant, which has been shown to play a role in preventing atherosclerosis and vascular occlusion. Another plant is the toothbrush plant, which a recent meta-analysis conducted on this plant showed to be effective in reducing the formation of dental plaque and tartar and preventing oral diseases. Medicinal plants are effective in preventing and treating diseases. Clinical studies and meta-analyses highlight several plants. St. John's wort is effective for depression, similar to SSRIs like sertraline and fluoxetine. Valerian helps treat insomnia. Chaste tree is effective for women's diseases by reducing prolactin, aiding hyperprolactinemia treatment. Cumin helps control obesity. These plants play important roles in treating various diseases. Another plant is turmeric. For example, a recent meta-analysis shows turmeric reduces pain and improves function in osteoarthritis patients. Medicinal plants can prevent diseases, but also pose risks due to their compounds. A consideration is their impact on drug metabolism, such as St. John's wort, which can increase the metabolism of immunosuppressive drugs, reducing their effectiveness. This can lead to faster elimination of these drugs, preventing their intended effects. There are cases where patients with organ transplants prescribed immunosuppressive drugs used St. John's wort for depression, resulting in transplant rejection. Additionally, plants like ginger can impact coagulation systems, reducing blood viscosity. What does this mean? Which is risky for those on blood thinners like aspirin, warfarin, or clopidogrel, increasing bleeding risk. Another effect of medicinal plants is their influence on blood electrolyte levels, including their effect on potassium levels. Some of these plants, like senna and licorice, can lead to a decrease in blood potassium. This reduction in potassium can have various side effects and can be particularly dangerous for certain individuals, such as those taking digoxin, as it poses a risk of toxicity. Another effect of medicinal plants is their impact on the liver, such as with Garcinia or Cambogia, which are widely used in weight loss products around the world. Garcinia is used by individuals for weight loss. Inappropriate use of this plant and its products can cause the liver failure. Medicinal plants are used in disease treatment, prevention, cosmetics, food, and beverages. Companies in herbal and chemical drug production, like Bayer, are key players in the herbal market. Valued at $66 billion in 2016, the herbal market is expected to reach $348 billion by 2028, a 100% increase. There are several factors driving the growth of the herbal product market. One is the tendency towards self-medication. Many people prefer medications they prescribe for themselves. Since chemical drugs are mostly available by prescription from a doctor, herbal medicines are available over the counter without a prescription. allowing patients to express their desire for self-medication. Overall studies show that herbal medicines have a lower rate and severity of side effects compared to chemical drugs. Information about herbal medicines is expanding online and on social media. However, not all shared information is accurate, as many lack sufficient knowledge. Despite this, people may still turn to herbal products. In cosmetics and hygiene, medicinal plants provide essential oils and colors widely used in these products. Social media platforms are filled with information about medicinal plants and herbal products, but this information is not always accurate. Unfortunately, a lot of this information is shared by individuals who lack sufficient knowledge and awareness about medicinal plants and herbal products. Nevertheless, people can utilize this information and may be inclined to turn towards the consumption of herbal products. The herbal personal care market was valued at $11 billion in 2011 and doubled to $22 billion by 2022. Major consumers are in North America, Europe, and Asia Pacific, with India and China leading the market, especially in skin and hair care products. Another role that medicinal plants play in medical science is the discovery of new drugs. Interestingly, 121 active ingredients used in the global pharmaceutical industry are derived from medicinal plants. One example of this is metformin, which is one of the most widely used drugs for treating diabetes and metabolic syndrome. There is a plant in the world called the galangal plant, from which a compound called galangin, which is a blood sugar regulator, was extracted, and they took the structure of galangin as a model and synthesized the drug metformin. Another drug we can mention is the drug oseltamivir, with the trade name Tamiflu, which is considered one of the best antiviral drugs, especially in the treatment of influenza. The compound called shikimic synthesis of oseltamivir. Interestingly, the compound shikimic acid has its main source in a plant known as star anise. Another plant worth mentioning is the toothpick plant, which is used in the synthesis of amiodarone from one of its compounds. Additionally, the plant periwinkle yields two valuable compounds, vincristine and vinblastine, which are widely used in chemotherapy. Highlighting Iran's unique conditions for medicinal plants. With diverse climates, Iran is home to 8,000 plant species, twice Europe's total. Interestingly, 12,300 of these are medicinal, and 1,728 are exclusive to Iran. Medicinal plants are vital in Iranian medicine, with most drugs derived from them having a long history of use. These are plant species that only grow in Iran. Medicinal plants hold a special place in Iranian medicine or traditional Iranian medicine because most of the drugs used in Iranian medicine are derived from medicinal plants. Therefore, these plants have a long history of use in Iran. An important point about medicinal plants is that while industrial medicine might seem orally passed down, Iranian medicine has over 17,000 preserved written sources from past physicians and scholars. Many focus on medicinal plants, offering information to inspire new products and drug molecules. Given Iran's unique conditions, efforts have been made to utilize this potential. Here are some actions taken over the past decade. But have they been effective? This slide may reveal their impact. These sources focus on medicinal plants, offering inspiration for new products and drugs. This slide shows actions over the past decade and questions their effectiveness. It shows Asian countries' export share of medicinal plants. China leads with 5,000 species and a $14.5 billion export share. Iran's unique conditions for medicinal plants have led to actions to leverage this potential. Here are some actions from the past decade. But have they been effective? This slide may reveal their impact. Now observe the share of Asian countries in exporting medicinal plants and products. China, with nearly 5,000 plant species, has a global export share of $14.5 billion. Pakistan, with around 300 species, has a share of $1.1 billion. Iran has 2,030 plant species. In this slide, you can see the share of Asian countries in the export of medicinal plants and processed products derived from them. If you pay attention, the first country is China, with nearly 5,000 plant species, and its share of global exports is $14.5 billion. Iran has 2,030 plant species, and its share of exports is only $550 million. 1% of the global market. Iran's low share in the export of medicinal plants is mainly due to selling raw materials instead of processed products. We sell medicinal plants raw and then import processed products at much higher prices. Selling raw instead of processed goods is an issue. We export raw medicinal plants and import their costly processed version. The National Plan for Medicinal Plants and Traditional Medicine, which was approved by the Cultural Revolution Council in 2013, envisions an increase in the export of plants and herbal products to position Iran among the top 10 countries in the world by 2025. And if we look at it, we don't have much time left until 2025. However, we are still very far from achieving this goal. Thank you very much for your attention, and I hope the information I provided has been useful.